Hi, everyone. Welcome to Wellness Wednesdays with Mindful Nurses. My name is Claudia Wong. I'm a nurse practitioner, yoga teacher, and co-founder of Mindful Nurses along with Janelle Smith. Mindful Nurses is a platform to promote self-care and wellness for nurses using holistic wellness practices. This is part of our Wellness Wednesday series. Where we have nurses, nurse practitioners, and wellness practitioners share a talk or practice to help promote the mental and physical well-being of nurses. So today, I'm really excited for the topic, 5 tips to feel 5 times better. And we're going to have that shared to us by Lisa Vasile. Lisa is a functional medicine nurse practitioner. She's from Massachusetts. She has a postmaster's certification in nutrition, gluten, and holistic health coaching. She's also the creator and owner of For Better Health functional medicine practice in Massachusetts. Her clinic strives to educate, empower, and inspire patients for lifelong changes by getting to the root causes of illness and managing conditions such as autoimmune disorders, diabetes, weight issues, brain fog, fatigue, and thyroid abnormalities. Lisa earned a bachelor's degree in science and nursing from Fitchburg State University and a master's degree in nursing and subspecialty in education from UMass Graduate School. During her 30-year career, she has served as a U.S. Army nurse for 5 years, taught with the faculty at UMass Graduate School of Nursing, Mass College of Pharmacy and Health Sciences, and at Mass Bay Community College. She has worked and taught OBGYN as well as has been part of 2,000 or more deliveries and hundreds of prenatal classes. She has always used movement and nutrition as the key to optimal wellness and vitality for herself, her family, and her patients. Lisa also serves as a preceptor for NPs, PAs, and MD students through shadowing and mentorship programs. Her passion has brought her to 2 health segment interviews with CNN, as well as many cable and radio shows. She presents regularly to inspire and empower the community and practitioners about functional medicine's deeper healing potential and to debunk the concept that it's normal or acceptable to feel crappier as we age. Today, Lisa is here to discuss how nurses and healthcare professionals can bring self-care and self-love to the forefront and share with us 5 tips to make us feel 5 times better. So I'm so happy today to have Lisa here present to us and help us all really feel better, and also give us a view of functional medicine perspective as well. So I'll pass it on to Lisa. Thank you so much for being here.
My goodness, thank you so much for that amazing introduction. I am so excited to be here and thrilled that you invited me on this wonderful platform. And what an amazing 30 years as a nurse. And this is something that I have been saying has been needed for all that time. Sharing with the people who are caring for others, how to care for ourselves is pretty huge. And so what you guys have put together is pretty amazing. And anyone that's listening, share, because we all need this desperately. Especially as somebody who's been an educator and a preceptor for years. One of the first things I tell my nursing students and my preceptees, don't let anybody eat you, because that whole nurses eat their young, it's got to be love on the young so that we can all be in this together and bigger and better and stronger. So this is great.
Thank you. Thanks for coming as well and sharing this with us.
Okay, so I guess I did put together a screen. I'm sorry, did you want me to share my screen now?
Yes, you can share your screen if it's part of your presentation. You can go ahead and do that.
It is saying that host disabled participant screen sharing. So I don't know if you want to fix that on your end.
Okay, try again.
There we go.
Okay, great.
Okay. All right, so let's go from the beginning for a slide. So I did put together a regular PowerPoint. I don't want to bore anyone. So hopefully some of this is fun, but also really inspiring as you go through it. And for those of you that are listening now, or for those of you that are going to watch the recording, it's a huge passion of mine, as she said, to make it so that we do not have that expectation of it's normal to feel like crap. And I hear it from friends and from colleagues and from patients and from family all the time. And I also hear it from even other colleagues who are in the medical profession saying, well, it's just because they're getting older. And I don't discount the fact that our body changes and that we may have to work a little harder to keep our body functioning at the level that we may strive for. But I am a huge passionate advocate for keeping our body as strong and healthy without the, well, I wake up and I had someone today say she felt like the Tin Man. She would get out of bed and everything aches and is stiff and it takes her about 15, 20 minutes of walking around before she feels okay. That's not normal. It's common, but it's not normal. So she did share a little bit of who I am. I'm going to just quickly go through this. As she said, I'm a wife of almost 30 years, a mom. I have a 23-year-old and two 19-year-olds, nurse, a business owner, health advocate, and educator. And nurses are the real heroes. It's amazing to me that any of the health professionals and any of the first responders and even the people that are driving Amazon trucks right now are getting the respect that we all deserve and need and desire, but we are the heroes. I used to have people coming to me saying, the doctor's great, but I want a nurse practitioner because you listen more, or the nurses are the ones that do all the work. And so it's not just even in maybe our profession, but it's also in our life, whether you're female or male, you're the one that is caring for everybody, but unfortunately often putting yourself not even on the to-do list, never mind a priority. And as we said, we're so used to taking care of everyone else that we ignore to taking care of ourselves. The fact that everything that works hurts, and everything that doesn't hurt doesn't work. Just like that Tin Man one today, I don't want anyone to feel that that's normal or acceptable. And this is a statistic that I found just recently in the wake of COVID-19 about, it was talking about burnout, but the article itself went on and on to talk about, in general, nurses and the idea that nurses are really not happy in their profession and they're leaving at astronomical numbers. And so that is not just about the health and wellness of our profession as nurses and nurse practitioners, but also in our lives. Because if you're not happy in your profession and you're not financially stable or even financially happy, all of that stress is going to be pulled into your own life and your personal life, and that joy or lack of. And that's where that mindfulness comes in, and that self-care and Wellness Wednesday comes in. I've told you about my professional side of what makes me passionate, but this is a little bit about my personal side. So up in the top left is my mom and dad, and if you look to the bottom top right, that's my dad when he had cancer, my sister with her celiac, and her son who has celiac. And then in the group photo, my mom and I in the very middle in the heart, she died of a very aggressive cancer who robbed her life at 64 years old. She was 6 feet tall and, as you can see, regal and beautiful and vibrant, never took a medication in her life for anything else, not outside of maybe an ibuprofen. We also had somebody who died of depression, bottom right. She passed away by suicide. And we have ADD and autoimmune, and this is my health passion. So it's not just my family, but it's my in-laws and it's my nieces and nephews, and it's my friends and family who really drive this, because there's that passion as a nurse that you want to help everyone, but when you can't somehow help your own people, it really drives you. And again, that comes down to yourself as well as the major person that's going to drive that boat. This is just a quick statistic. It's not like this is any kind of new information for anyone that's in the healthcare field, nurses and nurse practitioners especially. The amount of chronic disease in our life, in our world, is devastating. US unfortunately tops a lot of that. And if you look at the numbers, even financially, we cannot keep going like this. And so if we're going to be the ones that are taking care of everybody else, we need to make sure we're taking care of us first. So for those of you, Claudia mentioned me talking a little bit about functional medicine because that's the specialty that I practice in right now. And if you haven't heard of functional medicine, I like to think of it as the root cause, or making sure that your body is functioning optimally. So traditional medicine does an amazing job keeping us alive. They do a great job slowing down trajectory of disease, excelling to help us survive, but not always helping us to thrive. And a good example of that is just even taking diabetes. There's a lot that we do to slow down the trajectory of disease, and a lot of us are in the heart of that, teaching our patients, watching the patients come in and out of either clinics or hospitals, and we may ourselves know of a family member or ourselves that might be struggling with insulin resistance or blood sugar issues. And traditional medicine does a great job, talking about some of the carbohydrates and talking about some of the lose weight, exercise. There's just not a lot more than that. And if I continue with the diabetes example, in functional medicine, we look at not just lowering the blood sugar, which of course is important, but what's driving that to begin with? Is there things like a lack of joy, a lot of stress, lack of sleep, no movement? But if they are moving, what kind of movement are they doing? Is it rising? Is it so wrong for their body that it's raising cortisol, which all of us know raises blood sugar? Do they have nutrient deficiencies that they're unable to be able to put the insulin into the cell to get the glucose into the cell, and therefore there's glucose and insulin racing around, which is hugely inflammatory. And so that's just a little example of how functional medicine works. And you can see this little tree. They call it root cause medicine, looking for what else is the reason. I'm not saying that we don't want to address the right now in front of you things, but what other reasons might be triggering that unique body to work inappropriately? And it's all about body balance or body burdens, reducing the burdens and helping balancing the body. So I thought it would be fun, and of course I won't be able to see this right now, but I thought it would be fun to have people give me your best emoji if any of the next slides resonate with you. You can give me a high five or a, oh my gosh face or whatever. I thought it would be fun. But one of the things that I hear all the time from my patients, but especially from those of my, colleagues and students, and when I worked on the floor, I worked labor and delivery on the floor up until about 3 years ago. And so it's not like it was years and years and years ago that I was in the hospital working nights, weekends, holidays, 12-hour shifts, you name it. And so the energy piece is huge, right? So I'm pretty sure this might resonate with everyone on the call. And then the concentration piece, that brain fog, that lack of being able to finish a task, going into a room and having no idea why, going into the med room and going, crap, who was I in here for? And then the losing weight piece, no matter how much you try. But then there's also a lot of the blaming or excusing. And we can look around, a lot of us at work with our colleagues, or even if we look within and inward and say, am I using an excuse to allow this weight to sort of stay with me? Is it protecting me from something? Is there another reason that I can't lose weight? And a lot of times it isn't what we're eating, but it's how we're eating, and it's when we're eating, and it's the amount we're eating. And then, of course, that whole I feel like crap, but nobody can find out why kind of scenario. This happens a lot, and this is another reason quite a few patients come in to see us. They've been to 15 specialists and nothing's wrong. But clearly something's wrong because they're not themselves, and they can't get through the day without either pain or a headache or brain fog or a bloating or inflammation markers skyrocketing. And maybe one of these bullets are you or someone you know. It's very common for us to take a pill for blood pressure, cholesterol, blood glucose levels. It's also very common for us to grab something, and I'm not necessarily talking about prescriptions. It may be over-the-counter medication that people don't think of a medication. They call it a pill or a tablet, but they don't know it's a medication. Even if it's, you know, Pepto-Bismol, it's a medication. And so do any of these things happen once a week or once a month or even once a day where you're taking a pill to address it and to reduce it and to stop that symptom? And again, I'm not against it, but what else might be going on outside of a shortness or a deficiency of that pill that may be causing this? And it's time to stop accepting it and feel 5 times better. So in functional medicine and a lot of how I believe and what I've seen over the course of the last 5 to 7 years when I've really kind of veered from traditional medicine with one foot still there, because again, I respect it and I know that it works for really well in some cases, but there's just that missing tool in the toolbox, is that disease is actually caused by a disease, that burden and balancing that we talked about earlier. Symptoms, progression of treatment disease allows us to better protect and care for the bodies within, especially those of us that are caring for everybody else. So inflammation is the driver. It's the driver for all dis-ease in the body. And some of the signs of body imbalance and body burdens are here. And I'm not going to read off every bullet because most of you can read just as well as I can. But I do think that most of us can say, yes, that's me, or yes, that's my friend, my sister, my mother, my aunt, my cousin, my brother, my nephew, anyone in your family, and definitely 100%, you know a colleague that one or many of these pertain to. So that means that there's inflammation, and I'm hoping that I can help shed some light on that. And so in December of 2019, the Thailand Medical News went and published this whole research study about 22 different institutions. And this is in Thailand, but you can find similar studies in the US and across the rest of the world. But this is just, again, driving into the whole idea that chronic inflammation, is driving every disease. And so if we can reduce inflammation, and I'll get to that in the 5 tips, then we can really hopefully slow down this trajectory of chronic illness that is just skyrocketing in younger and younger people. So again, the dis-ease in the body itself means that the body is not at ease. We're taught to believe that diseases are either genetic or a normal part of aging, and to accept that. And again, please, if you can do one thing, walk away from this presentation and don't do that. And due to science advanced making a pill for everything, it's one of those things where it's like, well, I'm broken, I'll take the pill that fixes me. But this isn't necessarily fixing. It does maybe slow down a symptom or even take that symptom away short term. But we know things like, say, high blood pressure. I'll have patients come in and I'll look at their med list and they'll be on 1 or 2 or sometimes 3, usually 2 blood pressure pills. And I'll mention their blood pressure because they haven't written it in their intake. And they'll say, well, I don't have high blood pressure anymore. I'm on a pill for that. And so my education for them is that, yes, your pill is helping to lower and normalize the blood pressure, but that doesn't mean that you no longer have hypertension or high blood pressure. It means that it's treated. It's like putting a Band-Aid on a bleeding finger. If you took the Band-Aid off, it may or may not still bleed. A lot of times if it's a big one, you know, a good one, it'll still bleed, right? So you may need stitches. And so what we need to do is to why are you getting high blood pressure? What is happening within your body? Why are you getting headaches every day? I'll have a patient come in, 15, 20 years of constipation. And they've tried every medication that there is, over-the-counter things, fiber up the wazoo, And they're still maybe going, maybe not, but it's unpredictable. They're bloated, they're constipated, and it's normal from what they're told that their body just goes once or twice a week, which to me is, and so it's not normal. It may be common, and it may be common and normal for them, but it's not a normal behavior. And so why are they constipated? And one person in particular, 20 years. Talked to her yesterday. She's going twice a day. She doesn't even understand that her body could do that. And so what is happening underneath that is not being addressed? And the whole YOLO, I'll sleep when I die, or what, the only YOLO, for those of you that may not know it, it's you only live once. I have way too much to do to address either whatever your pain or ache or symptom is, or even diagnosis, is only adding later, as we know, if with our patients, but for ourselves, prioritizing and addressing those up front will bring us so much more joy and health and vitality, and being able to address those things and go, for that matter, go to a wedding or something that you might miss because you're not feeling well. And then this is just a wonderful quote that I love. And so if you're feeling like poop, it may be that you're having a little bit too little of some or too much of others, too little sleep, exercise, good diet, healthy fats, water, or paying attention to the red flags, and too much of the other things that are on the burden side. And so let's get to the maximizing and minimizing to help you feel better. The top 5 things, it was tough for me to kind of come up with 5, because I'm so used to sort of doing a big, what we call a blanket or a big fishnet, and kind of getting my intake for our patients, and you're gonna laugh, for those of you that are in traditional medicine, is anywhere from an hour to 2 hours, and you're like, there's no way, how can you possibly do that? But in order to really get the deep dive, I want to know about the right now stuff that everybody else does. I still do the traditional medicine. I still do all the vital signs. I do regular labs. We do all of that, but we also want to know, how old were you when were your parents when they met? Was it a happy relationship? Was it a good pregnancy? Was it a happy pregnancy? Were they happy to have you? What was your birth like? And going, how many illnesses did you have? Did you have any what we call adverse childhood events? And so ACE, adverse childhood events, it's 9 p.m. here, so I'm having trouble speaking, is tough, because these are things that happen to us before 18 years old, and it might be abuse or neglect or alcoholism or sexual abuse. Things that happen to us when we're younger can build on discord as we get older. And for some, that drives people to become a nurse or to become a therapist, or things that we want to serve others because we know what the pain was like, so we want to serve others, which is amazing. We still need to make sure that we're healing that child within. And so for me, again, it was a little hard, but I went with these 5 here. And so we'll start with the nutrient density and reducing or removing, if you can, some of the most inflammatory foods, which again, this is where these, hopefully these slides make you giggle as we go along. But what you find at the end of your fork is the most powerful thing, and way more powerful than anything that you'll find at the bottom of a pill bottle. And then we're talking about nurses, right? And so what our life is like on the fly, in between patients, whether it be in the office or especially in the hospital, and especially during everything that's been going on over the last 5 months. Dieting, paying attention, or even having time to eat, it's an enigma. And so being able to make sure that you have something on the go on the fly, instead of the Mountain Dew and the cupcakes and the cookies that people brought in, or the donuts that the patients brought in, very nice of them, but, looking, where is it? It's not here, sorry. So looking at the statistic of 95% of chronic disease being caused by what we're eating. Hippocrates said it hundreds of years ago, about letting food be thy medicine and the medicine be thy food. And here's just a quick, an aspirin a day will help prevent heart attack if you have it for lunch instead of a cheeseburger. So this is talking about the U.S., but you know, and I know that a lot of the rest of the world has slightly better statistics as far as food consumption, but it isn't. I know that these McDonald's are spreading throughout the world, unfortunately, and so you know, food health all over the world, unfortunately, is at a state of plateauing, if not deteriorating, as you know, in younger, as I said, instead of healthier. And so this slide I thought was earlier in the slide deck, so my apologies for trying to skip ahead. But this is the oxymoron, right? So if you do have time to eat in the hospital, you're running down to some of the most unhealthy foods. Now, that's not to say some hospitals don't have amazing cafeterias. Some hospitals may not even be open right now. I know the hospital that's local to me shut down their cafeteria entirely during COVID. And so people were bringing food in, and if they had time to eat, it typically wasn't the healthiest food unless they were really prepping and thinking ahead. So nutrient density really does cause hunger and brain fog and dementia. There's lots of studies here. I wanted to make sure I made this somewhat medical for you guys, but it also increases fatigue. And as we know, it just sets us up for feeling crappy, eating crappier, more brain fog, more snacking, and you're hungry 5 minutes later, and so you just eat again. And so the best foods, if you can, focus on trying to either remove or get out of your diet, reduce for sure, are these 6, 7 foods that I put here. When I look at food labels, and believe me, I'm not perfect. I don't think anyone should be or could be. But you know what's going to reduce autoimmunity, cancer, obesity, heart disease, those things that I see patients suffer with and worry about and are afraid of, and make them tired or miss out on good stuff like weddings and birthday parties and things that I don't want to miss out on. And so when I look at labels, these are the things that I avoid. Sure, if I'm going to have, say I'm going to buy my kids ice cream. So if I'm going to do that, then I'm going to get the one with sugar, and it's going to be cane sugar. It's not going to be any of the high fructose corn syrup or any of the sucralose, sugar-free type things. I really try very hard to not eat food that has color unless it came from the plant. I don't do dyes. And I would recommend people to try to, maybe you can't do it 100% of the time, but really start to look at labels and not the marketing on the front. I try to make sure people think about that, because you can write no trans fat on the front of a packaging, but on the back and the ingredients, you can, clear as day, you can plainly see that it has saturated, polyunsaturated, hydrogenated trans fats in there, trans fats in there, in the food. And so if you have a little bit, and it adds up, you're just adding dis-ease to the body. And the body doesn't know what to do with a lot of these things, and it distracts the body. Thinking food when you're eating, is it adding to your food, to your health bank, or is it withdrawing from the health bank? And it's really hard as nurses and nurse practitioners, I get it, or any other health provider, because you're on the run, but it isn't totally impossible. I remember working in the hospital, like I said, when I left about 2.5, 3 years ago, people would say all the time, like, why are you so good and bring your own food? You're thin and you're healthy. Why don't you, give it up every now and then? And I'm like, because I don't want to feel like crap. And so the longer you do it and the more that you do it, the more it feels good. And then when you have a little bit of the other stuff, you're like, why do people do this? But for sure, if it's coming through a car window, none of it's good, right? And I love a coffee, don't get me wrong, but if it's coming through a car window, it's really not the greatest food for us, and it's not adding to that health bank. Sugar is a big one too, so trying to reduce as much as possible. If you look at this study, if you look at this incidence of all of the diseases across the world, this is the same map if you were to Google sugar consumption in the world. And so the countries with the darkest and highest percentages that you're looking at here on the slide also have the highest consumption of sugar and sugar-laden products. And so that speaks volumes to disease in the body and being mindful for our wellness. This is just statistics, and this is only up to 2010. If you continue to look at these slides, they actually have a movie that you can watch that goes year after year after year, and it adds more and more and more colors. And so I think there's 3 more colors since 2010 in the last 10 years, blues and dark blues and other colors, which is horrifying, especially because this is 18 and older, and it's happening as young as 12, 13, 15. People are having issues with non-alcoholic fatty liver caused from sugar. And this is just a little statistic for all of us. If you want to watch this YouTube video, it's a great video about sugar. And then just talking about the brain-derived neurotropic factor and how that's completely looking at how the brain is working, and now calling dementia type 3 diabetes. And that's coming from sugar and coming from the insulin resistance that we have in the world. So getting back to the basics, nutrient density, minimizing processed and inflammatory foods. And again, I don't want to sit here and read everything, but for those of you that are listening and not watching, I like to say the 90-10 rule, which is 10% of the time, sure, go ahead and enjoy something fun. I don't like to call it cheats, I like to call it joys. But just make sure that it's really truly a joy, so that there's no guilt and no anger and no self-loathing. And then you actually taste it and smell it and enjoy it. So instead of shoving a chocolate bar in your mouth and that's a cheat, did you enjoy it? Is that a joy? Because that is more of a self-loathing, shove something in, hurry up and go, but there's no self-love there or joy in the food itself. And then looking at trying to eat as much of the food the way that nature makes it, and less of the food that the human makes, and mankind make. There used to be somebody, and I forget who it was, Michael Pollan, I think, eat food, not a lot. And I think there's another one that's something about not eating food in the factory. I wish I had that in here. But this is just a little pun here that I made up. Back away from the bagel, move away from the muffins, stop slurping down the cereal, put the pancakes and pretzels down, break the bread habit, walk away from the waffles, cut down on the crackers, and please don't get me started on pasta. This is all about gluten and the processed grains that we're so addicted to, because gluten can be one of those foods that even if you don't have an allergy or a sensitivity, it's so addictive, and it can really cause things like headaches and joint pain and brain fog, even without a sensitivity or any kind of an allergy. And so then getting into the tips of stress reduction, which is a huge one for this particular forum and this huge, this group of people with the mindful nurses. If this isn't a priority, we can't get anyone better. So I will have patients that come in, and these are some funnies that you can all read while I while I tell my story. So I have patients that come in who will eat an autoimmune diet, which if those of you that know what that is, it's really a very difficult diet. They will exercise. They will, you know, buy every app in the world, 100,000 supplements a day, but they won't address the stress. And that stress may be stress from a marriage, from a job, from a mother, from a terrible house that's making them sick, you know, whatever, mold or something like that, or even, like I said, childhood stressors that they never were able to support. And then they have their job stress, nurse practitioners and nurses, and then that's why I had to do something funny here because my story is kind of serious. But if you don't address the stress, we can't get you better. I tell my patients that it's like there's 4 legs on the table, and I can do the 4th leg is stress. And so I can balance you and I can make you better, but you have the littlest plant or a pet touch that other leg and that other part of the table that doesn't have the leg for the stress dealt with. There's no leg there because you haven't addressed it. Your whole entire balance is going to be off, and your wellness is not going to be complete or optimal. And so I hope you enjoyed these slides. I couldn't help myself. And then redirecting stress is not just about feeling better and getting the body to be helpful, but it's a true physical issue as well, with cortisol and ghrelin and the way that our metabolism, blood sugar, blood pressure, all of that is addressed. And so we want to make sure that we're addressing those to lower physical downstream true issues. Some of you may have even heard of adrenal fatigue, which is really the true name for that is HPAT dysfunction, which is hypothalamus, pituitary, adrenal, and thyroid dysfunction. The stress and that chronic, simmering, consistent, persistent stress from whatever it may be, and it could even be a food sensitivity. Some of those stressors could be from the crappy food that we already discussed, is constantly pulling from the adrenal gland, and in doing so, it's making the entire HPAT hormone regulation dysfunctional. And so it's not optional, and this is the group I shouldn't even be saying this to, but it is imperative that we address the stress or we won't get ourselves better. And so there's all sorts of ways to do that. This group knows those ways. We talk a lot about using apps for tapping, for breathing apps. They have them now. Even the iWatch has that. We have the meditation itself. You can do on YouTube or an app. You can do Yoga Nidra. You can do Qigong. There's so many things that are completely free. And then there's other things that are not free that are helpful as well. And it's important that we reset that. And I tell a lot of people, it's almost as if there's an energetic block, and no matter how much you do, if we don't move those blocks back to where it's supposed to be, the river's going down the wrong path. And we want it to go down a smooth path without any bumps and turns. And so you guys know all that. So it's a huge imperative piece to healing. The third tip is moving. And my husband and I were talking about this earlier today. And you know, the statistic of Americans, I'm not sure about the rest of the world, but is less than 20% of Americans that exercise more than 30 minutes, more than twice a week. And so if we don't move the body, it can't move for us. And that means metabolism. That means, again, clarity, brain fog. That means being able to support the cortisol, be supporting the blood sugar, that mentality and stress reduction piece, depending upon what kind of exercise we're doing, of course. But it needs to be every day. Even if you're not going to go out and exercise, walking 15 minutes away from the house, turn around and walk back. You don't need to have a path. You don't need to have a track or a hiking path or a special route. Someone today, she doesn't have time for that. I'm like, okay, do you have 8 minutes? Can you walk away from your house 8 minutes and walk back? First thing in the morning. She's in grad school and she's working from home. And then can you do that again at night? There's 30 minutes that you're going to do every single day. And then on the weekends, when you have more time, you could do a little bit more exercise, but it needs to become every day. Here's some more funnies that I like to share with my patients as well. Every now and then I'll shoot them a meme like this and say, hey, have you exercised? And they just think it's funny, but you need that accountability. You need that push. If we don't move, our bodies can't move for us. And so getting moving, also, I talked about the insulin resistance, but it's also about dementia. They did a lot of studies now, again, because of that whole type 3 diabetes piece. But people that move on a regular basis, exercise on a regular basis, have less dementia. And for me, as you heard, that's important. Also, the fatigue piece, that was one of the first slides. You're going to be less tired. You're too tired to exercise, but if you do it on a regular basis, after a couple of weeks, you're going to be less tired. And you're going to sleep better. So that sleeping issue that most of us have will be lower. And then the other piece about moving is not just the dementia piece, but also the fatigue, but the bone piece. I can't tell you how many people, I'm in my 50s, are in their 50s, 60s. They come in because super high, they're taking all sorts of calcium to protect their bones, but they're not moving. And I have to share with them that exercise is going to help your bones. Number one, it's going to keep the bones stronger, but it's also going to give you that ability to roll should you fall, and the muscles and the ligaments in the bones to have more resilience to a fall if you did fall. And so you're going to get hurt less if you exercise on a regular basis. Calcium's not doing any of that. And quite honestly, you're going to have a higher risk of having a heart attack. It's like 1 in 4 for women after menopause, than breaking a bone from osteoporosis, and moving is going to do that as well. And so really re-educating ourselves as nurses to help our patients, but also we got to be the ones, right? We got to walk the walk, not just talk the talk. And that was a pun intended, because, you know, walking is moving. And then here's just some tips as far as getting that in. I love the 7-minute app. I use that a lot for my patients. It's free. You can do it if you don't have it on your phone, because I don't think the Androids have it. You can do it on YouTube. And it's great. You can do that twice, and that's 15 minutes, and then go for a 10-minute walk that night. You can fit it in anywhere. Okay, and so then the next one is sleep and focusing on sleep hygiene. And again, this is really tough for those of you that have, you know, you might be working 12-hour shifts, which means that you're really there for 13 and you have to get there and get home. So that's a 14, 15-hour day. So of course, that's really tough, especially if you're doing that with potentially shift changing. You know, you may be doing days, evenings, nights, or just nights, that kind of thing. So I totally respect that, and I validate that. I don't want it to discount that, but if we can really try to focus on all these other things to help the sleep that we've already talked about, and also to focus on how to get better sleep as far as sleep hygiene. Again, I really love memes, because I think that they just give us a giggle. And as I said to my husband, when you're in a presentation as a nurse, it's so dry and painful that I like to share these kind of things. So these are tips to make us have a better sleep hygiene. And so that's talking about a bedtime and waking regime. And even during COVID, I typically get up between 5:36 to exercise and start my day. And so I might have pushed that to 6:37 because I didn't want to sleep until 8:39 and then just be completely all whacked around. And so looking at these different tips of, if you feel tired, take a nap. It really has to be 10, 15 minutes, not an hour to 2 hours. You could even instead do a yoga nidra. Yoga nidra for about 10 minutes gives your body, and those of you that do this would be able to quote this better, but I think the statistic is something like a 10 to 15 minute yoga nidra is about an hour long. The body thinks it's slept for like an hour. So, and it's a better way to do that than to get in a bed and to sleep, and you're just gonna really kind of push everything off inappropriately, unless of course you need that 1 hour nap because you're working nights. And then looking at the caffeine intake, how much, when do you stop taking it, what are you eating for a bedtime snack? If you're eating sugar or processed foods, you really want to change that to like a handful of almonds or almond milk, or a piece of chicken, or a small piece of protein, so that you can control your blood sugar while you're sleeping. A lot of people have trouble sleeping because they're eating something sugary at night, and then their insulin has to work all night, so the blood sugar crashes, and then they wake up because the body's supposed to, which is a healthy thing for them. Looking at your routine of working out, as we'd already discussed, and your bed. I can't tell you how many patients I ask about their bed. They haven't changed their bed in 15, 20 years, or their bed's uncomfortable, or someone in their bedroom is snoring, or their pet's in their bed, or their bed is too cold or too hot or too light or too dark. Whatever it might be, you need your bedroom to be sacred to sleeping, and the fun thing of, intimacy, but nothing else. No TVs, no phones, none of that stuff. Trying to make sure that noise, if you need a noise maker, you can get even on like I think they sell for like $12. Just go ahead and put on a noise sound machine. The snoring piece, I do like to make sure I talk to people. If you're a snorer, I would 100% get evaluated. All of us in nursing know that really does increase blood pressure, excuse me. So it not only does it increase blood pressure, but it increases the risk of metabolic syndrome in general and strokes. And so let's get that fixed, even if you have to use a CPAP. And then we do all these other things so that you feel 5 times better and you're sleeping better and you can lose weight and whatever it might be. If you need surgery for the snoring, whatever it may be, we really want to make sure you're addressing snoring. And then this is some of the things we already talked about. Some people will ask me about, well, what do you use for sleep aids? Because we do know that Benadryl does have some effect. It does cross the blood-brain barrier, so it can affect long-term. It can cause sometimes issues potentially with dementia, a lot of it down the road. And we use, lavender, chamomile tea, sometimes valerian, very short-acting. 5 tips feeling better. The last one is drinking more water, and who wouldn't if that guy was the one saying it. And then just, of course, now I'm talking to nurses, so they're like, I don't have time to drink water, or if I do, I have to pee. And for that matter, those of us that are walking around with masks on 24/7 now, we can't get water through the mask. You have to go and hide in the bathroom to drink water. So I get that. But when and if you can, the goal would be to drink half your weight in water every day. And of course, it helps to lose weight. It helps your skin. It helps brain fog. It helps energy. And of course, that constipation thing that we talked about. Trying to reduce all of those chronic illnesses that we're so worried about. A lot of people that have headaches, it's because they just don't drink enough water, and then irritability, that kind of thing. Less than 1% of people drink 8 glasses of pure water a day. People will then start talking about me that they don't love water. Here's some statistics. If you go back and look at the slides, I don't want to go over too long here, so I'm trying to make sure I don't read every slide. But for those people that don't like water, the things that I usually have people do is make yourself some infused water. You can do it with throw a strawberry in a water bottle, cucumbers, lemons, orange slices. You could also do something called Ultima, which is ULTIMA, which is a sugar-free. It's got stevia in it, but it has no sugar, has all sorts of flavors. Another one is called NUUN, Noon, and both of those are electrolyte tabs or electrolyte powders, but there's no sugar, and they have a little flavor. They're delicious. You can leave them in your purse at work, leave them in your purse at home or in the car. And so that way you're drinking more because, it's more palatable for you, and maybe you do need the electrolytes. It's not going to overdo it even if you don't need the electrolytes. But that way you're drinking water because, I don't like water. Some people will drink seltzer, that's fine. I wouldn't make sure that it's not more than 1 or 2 glasses of seltzer today. You want to drink regular water as well. Filtered water is better if you can, but drink water and lots of it. So to recap, you deserve to feel great most days. And so when I ask that to patients, they say, one of our questions is, when was the last time you felt great? And sadly, some people say 6 months ago or a year ago or 3 months ago or 4 years ago, and other people will say, I don't remember. And to me, that's just devastating because we want to make sure that we feel great most days. I mean, there's days I don't feel great, but I feel good every day. And then there's 1 or 2 days a year that I feel like crap. And so if it's the opposite, that 1 or 2 days a year you feel good, but most days you feel kind of crappy, then we need to fix that. And as a nurse practitioner, you want to be in charge of that because you're caring for other people. You deserve to have energy and clear thinking and get through the day without that, you shouldn't wake up with that ever. So I love to say, imagine if like the machines that we're so in tune to, whether it be our phones or all of the machines we use at work, or the EMRs that many of us are using, all of them have all these symbols that we have to click on. Imagine if they told us and we had a check engine light dashboard in our body, and we had to address it because you wouldn't drive around your car with any of these dashboard lights on, at least not for very long, because you know that you'd be stranded or you'd get in an accident, and none of that is going to help you enjoy the rest of the day, the rest of the week, the rest of the year, or the rest of your life. And so let's make sure that our body is treated the same way as our vehicles. In functional medicine, I wish we had this kind of a dashboard where it just kind of goes right to the juiciness of, this is what's wrong with you, stop and fix it right away. And so I love this, this kind of dashboard theory for those nurses that really kind of need it in our face to take care of ourselves. So the next time that you go grab a medication of some kind, even if it's over the counter, I'd love for you to stop and think, or if you see a colleague or a friend or a loved one, I see that you take Tums all the time, or you're taking Advil again, what's going on? You're not deficient in that. Go ahead and take it to reduce the symptom that second. But let's find out what's wrong with you so you don't have to keep depending on this, because it could lead to 3 other things down the road next month or 3 years from now, and let's instead go the other way and reverse it. So am I deficient in those kind of things, the ibuprofen or the Tums or Miralax or Tylenol PM, or for that matter, coffee? Or do I just need more self-love? And that's where the mindful nurses comes in. And so hopefully that's helpful, and hopefully you can take those 5 tips and move forward every second, every minute, every hour, every day, because your friends and your patients and your clients, they all need you. And that's it.
Thank you so much, Lisa. That was amazing. We love the memes, by the way. People are liking the memes, and I
Oh,
think,
good.
yeah, I think they really um, are appropriate for nurses too, and on the floor. And it's hard to really understand what's going on the nursing floor for those people that work on the floor, unless you're a nurse. And
No, I mean, none of us can understand it unless we've been through it. And I respect that. And I completely empathize with all of that. We have to take care of ourselves, though. We really do.
yeah, so that was great. I do have a question here from Tabitha. I'll go ahead and read it to you. Or I think it's more of a comment. I'm not sure. Let's see. I'm a former longtime night nurse with chronic health issues. Definitely feel like I developed adrenal fatigue over the years. In the last 6 months, switched to days and have finally been getting regular sleep. Trying to exercise regularly, also addressing stress in lots of ways. Still having fatigue and trouble losing weight. My chronic issues aren't improving. Thanks for the information about inflammatory foods. Definitely need to reduce processed foods. Didn't know gluten was bad unless you have insensitivity. Thanks for the information.
Oh, that's great.
Yeah.
Well, if you don't feel better when you start changing your diet some, then you definitely want to seek out somebody that will do some deeper dive testing through functional medicine, because they're all over the world. We practice all over the world. And so take care of yourself, because you're important.
Yeah, that's great. Yeah, I'm glad you made those changes, Tabitha. And yeah, food is medicine. Oftentimes we kind of overlook that aspect of it, or people do, but that's like very important.
That's the number one. Yep, number one way to get better.
And then someone else also had a comment that that they're addicted to sugar, and they're a nurse, and they're kind of, upset about it, understandably. Do you have any tips for people that feel like they're addicted to sugar or anything?
Yeah, that's a tough one. So the hardest thing to do would be, is to, you can't just go cold turkey. Most people have tried and it just doesn't work. And so my sister and I did a sugar, I guess, cleanse. I don't know what else you would call it, about 10 years ago. I would have it here and there, but she was, unbeknownst to me, incredibly addicted. And so we did something where the first week, all you do is write down everything you have with sugar in it. So you write down 100% of what you're having with sugar. You even the grams, if you can, like really look at every single solitary label, look at your ketchup, look at your drinks, if you're getting something through the car window, you look it up online. What does that got in for sugar? Every single thing you put in your mouth. And then the next week, all you have to do is go cut it in half. So the second week is everything that you did the first week, you can still have it all, but just cut it in half. And then the third week, you try to replace the things that you're putting in with sugar with sweet things. So a really good example is if you're a candy eater, then things like dates and raisins and things that are really high in sugar, watermelon, things that are kind of really sweet. And if you needed to do things like stevia, so that you can, and then the last week you try to not have anything that's sweet. So you're completely taking that palate, because if the palate's going to be addicted to it, even stevia will continue to have that, or monk fruit or coconut sugar, all those things that are still sweet are going to have your body still craving it a smidge. But slowly going through the process, even if it ends up taking 8 weeks. And then kind of coming down to why is she addicted? So what's making you drive to that, right? So typically it's stress, which we've talked about a lot tonight, and then lack of joy. So balance, burden, right? Getting to those.
Yeah, that's a great way to cut down sugar and really look at the root of it too, and just making yourself aware also of how much sugar you are consuming, like kind of blindly.
People don't know. They don't know. Even things like, people will email me and say, Lisa, I had no idea my almonds had sugar. So things that you're eating that are kind of healthy, really truly pay attention, because to stay as healthy as possible metabolically, you really want to try to stay under 30 grams of sugar a day.
Mm-hmm.
And that's only 4 teaspoons, which is very easy to, I mean, those Chobani yogurts, the blueberry ones, I think they're 24 grams.
Mm-hmm. Yeah. Yeah. Portion control is like so important also. Of course. Yeah. I just wanted to see, there are some things that came up. Oh, you mentioned Yoga Nidra. We actually had a free online wellness series during Nurses Week, and we have a Yoga Nidra session there for free. So you guys can watch that. People that attended found it super relaxing. And then I wrote down, I found the information. It's 30 minutes of Yoga Nidra is equivalent to like 2 to 4 hours of sleep.
Right. So I knew it was huge. When I had my twins and I wasn't sleeping at all when they were little, I used to do Yoga Nidra, and it truly got me through the first 6 months of their lives. Because it was like taking a 2-hour nap, but even though it was 15, 20 minutes.
Yeah, beautiful practice. And then the quote, Michael Pollan was, eat food, not too much, mostly plants.
Yes, thank you. And then there's one about factories. I'll have to comment that one after. Something about not eating. Eat plants, but not eat things that are plants, but not what's grown not made in a plant, or something to that effect. I love his quotes. Yeah.
Those are good ways to remember. Yeah. Let's see what else. I think that was basically it. Oh, and then I wrote down the electrolytes that you mentioned to kind of spruce up water and give you a boost of electrolytes too. So
that's great.
I'll look at that. But thank you so much. That was a great session.
Thank you for having me. This was fantastic. I love what you guys are doing. I can't wait to listen to the rest of these now that I'm part of the group. The invitation has really inspired me.
Yeah, we have wonderful sessions, and we'll be posting it on our Facebook page and Instagram at Mindful Nurses, and also our website, www.mindfulnurses.net. And if you guys want to watch the replay, or you can share this video with whoever you think would benefit from it, nurses, non-nurses, and stay tuned. Thank you so much, Lisa.
Thank you again. Bye, everybody.
Take care. Bye now.